Well, good morning, ladies and gentlemen. This is the Truckers Podcast, FYI. I'm your host, Doug from Ontario, Canada. It is the 21st. It is 8 a.m. Eastern Standard Time here on a Sunday. Hope everybody's had a good weekend. And it's been a snowy weekend here in southern Ontario. But the temperatures out there are getting better than that they were in the past week, where it was just bitter cold. So that's winter for you, the great Canadian winter. So glad to be out here again. Last Sunday morning I did a show, and here we are again, which it will be Sunday mornings until further notice, but that's where I'm going to stick with. And the other day, I added a new microphone, and it arrived the other day, so it's the first time using it today. It is the Shure microphone, and yeah, I hope hope the sound is really good. So, anyways, on with the show, and health and wellness. The effects of homelessness and nutrition and the elements and their overall health compared to what? To the rest of the general population who are not experiencing homelessness. But you don't have to be experiencing homelessness to have health problems and nutritional problems. Affordability comes into play. People struggling every single day across this great country of ours here in Canada. Low-income families, and how that plays on their mental health and nutrition. Now, over the past couple decades, research has been dedicated to exploring the relationship between health and the homelessness. And this relationship is a two-way street. Experiencing poverty and or homelessness can contribute to health issues, while health issues can contribute to poverty and homelessness. And people experiencing homelessness are susceptible to the same issues as people who are not. But their living conditions tend to make treating and coping with issues much more difficult. Studies 90% of homeless adults entering permanent supportive housing reported two or more chronic conditions. It was either physical or mental. It is just people on the streets who are affected. And this Canadian Pediatric Society study found that being vulnerably housed also contributes to poor health. They go on to say that there's no concrete numbers on the health of Canada's homeless population, but what they do know is some conditions are more common amongst them than others. This is Dr. Stephen W. Homeless. He wrote an article on homelessness and health and gives a detailed overview of these. Um, but this post summarizes the 10 most prominent ones: mortality and unintentional injuries, bruises, cuts, burns, etc. So the injury rates amongst people experiencing homeless are greater than in the general population. For an example, the prevalence of traumatic brain injuries alone among homeless individuals is between 2.5 to 4 times higher than the general population. And the presence of a brain injury can lead to further injuries. Commonly reported injuries among people experiencing homelessness included assault-related injuries and injuries related to situations where they're exposed to, i.e., cooking with fire and leading to burns. And these harsh conditions of being homeless often lead to serious injury or death. Now, with the tent encampments that are up and around the city, people trying to stay warm, um, we've had instances where they've had fires in these tent encampments for people trying to stay warm. It is very dangerous. It is not a safe place for anybody. And why do we have so many people as homeless in Canada? And a lot of factors play in that. With mental illness, low income, not be able to get housing because of the lack of housing. So it comes down to the affordability. People who are on a disability, um, single person, I think it's somewhere around $900 a month. Um, People who are on social assistance like welfare, I think it's somewhere around $750 a month. And the lack of housing in the city provided by the city, where there are wait times of up to 10 years, and the lack of building affordable housing over decades. Now, living in these harsh conditions of being homeless often lead to serious injury or death. They're experiencing disorders that affect the joints, ligaments, and tendons, like arthritis, are common among people experiencing homeless. There's a steady link to chronic pain in homeless individuals who were mentally ill. Chronic pain is a symptom of an underlying condition. And then although in many cases related to homelessness, it is not always possible to treat. It can be negatively affect these individuals' general activity like walking, sleeping. And while the prevalence of chronic pain is significantly higher than the rest of the population, the directionality is unclear, and this means that it's unclear whether chronic pain causes homelessness as an effect of it or even both. Hunger and nutrition. I mean, you don't know when you're going to get your next meal. In a developed country like Canada, it can be tough to recognize hunger as an issue. Yet, according to proof research, in 8 households in Canada experience food insecurity over the course of a given year. And adjusting eating habits to correct nutrition can aid in the treatment and recovery from a number of chronic conditions over time. One in 8 households in Canada experience food insecurity over the course of a given year. And that's probably going to grow because of the cost of food that we're seeing today. Other issues people experience homelessness is skin and foot problems. People experiencing homeless are often out and about for long periods of time, sometimes in ill-fitting shoes, worn-out socks, foot-related problems, infections, pains, practical limitations, etc. are more common among the homeless because of this. One study finds that up to 2/3 of the sample population of homeless individuals reported an issue with their feet. Nail pathologies, infections, injuries, bunions, hammer toes, gout, plantar warts, foot ulcers, and frostbite. Another study found that prevalence of skin conditions ranges from 16.6% to 53.5%. Conditions found in the homeless population include acne, psoriasis, and other chronic issues. Infectious disease. So, during the COVID-19 outbreak, individuals who experience homelessness tend to be at a greater risk during the pandemic outbreaks due to the compromised immune systems, poor nutrition and hygiene, and frequent overcrowding of shelters. And for this reason, the health measures implemented to minimize the effects of the pandemic outbreaks in homeless populations need to be beyond the mainstream solutions. Trying to get everybody vaccinated. There was a small study conducted across homeless shelters in Hamilton, Ontario, and they found that 1% of the residents to test positive for COVID-19 and 5% of their staff. This is a high infection rate, especially for individuals without access to health care or the basic human needs. And furthermore, some activities that some homeless people engage in, such as survival sex or intravenous drug use, also increase the risk of spread of disease. And this, combined with barriers many homeless people face in getting treatment, make avoiding infectious disease difficult. Dental problems, it's part of our overall health. And they go periods of prolonged homelessness are often detrimental to people's oral health, and the inability to access preventative and restorative care, combined with poor hygiene, often results in tooth decay and other oral issues. And the proactive dental care to prevent decay and catch dental problems early on, but 23% of people experiencing homelessness had visited dentists in the past year. 75% of these individuals also believe they have an untreated dental condition. Simple as just starting cavities. Respiratory illness, chronic obstructive pulmonary disease, bronchitis, and Other forms of respiratory disease are also common among people who experience homelessness. Chronic diseases and disorders. Many chronic diseases and disorders like hypertension and diabetes are common in the homeless population, and the homeless adults are 2 to 4 times more likely to have hypertension than, than other cardiovascular diseases than the general population. Diabetes among the homeless adults is around 4.1% and only slightly higher than the prevalence of 3.2 in the general population. Sexual and the reproductive care in this area of health with a growing research base, especially among young people who are most at risk. Youth who are homeless tend to have more sexual partners and at younger ages, making them more at risk of sexually transmitted diseases. 6% to 22% of young women who are experiencing homeless may be pregnant. Being homeless makes reproductive conditions like pregnancy even more stressful due to the already having compromised health and lacking support systems. I don't know if anybody's ever volunteered in a homeless shelter. I have. It was back in 2015, and thank you for joining me. I'm your host, Doug from Ontario, Canada. Thank you for joining the Truckers Podcast. Just talking a little bit the effects of the homeless in nutrition, and of course other issues that they face, like the mental health issues, chronic diseases and disorders, dental problems, infectious diseases, skin and foot problems, hunger and nutrition. The list goes on for what people experience in homeless and being homeless. Um, when it comes to the mental health issues, mental health issues are quite common in the homeless population. And studies revealed a prevalence of 20.8% for mental illnesses of any kind among people experiencing homelessness. And this is only 1 to 3% higher than the prevalence in the general population. That's, with the mental health issues, then we look at, so the lack of nutrition, they have very little to no money. Across Canada, and it's not just Canada, other places around the world, and, United States, over in Europe, people experience homelessness, the lack of affordability, the lack of housing. But you can also look at people who are living in poverty, people in low income families, struggling just to pay their rent, struggling just to put food on the table. Here across Ontario, if you are struggling to pay your bills, like your heat and hydro, they can't turn your heat and hydro off. Government put a stop to that. the Ontario government put a stop to that. But there are places that can help. And of course, the utilities, they'll help get things back on track so that coming the warmer weather, you're not going to have anything turned off. Then when people think about the homeless, they just think about people who are just, mental health issues. They're down and out. They have other things going on. There are people who work and are homeless. People living in their cars. You have the hidden homeless. People who are couch surfing from sofa to sofa. Low paying jobs. People finding themselves out on the street because, their landlord comes along and say they want to do a renovation, and it's called a reno eviction. The tenant has the first right of refusal. They can move back in after the renovations are done at the same rent that they're paying. But the whole purpose of these reno evictions, what these landlords are doing, is to get you out so they can charge more rent. Hamilton, Ontario, I believe they are looking at making rental evictions illegal. We've talked about it here in the city of London where I reside. And it's so prevalent out there, these rental evictions, that it's ridiculous. Few kilometers from where I live, there's a battle going on about rental evictions in 2 high rises. People there living on fixed incomes are in a battle with the owners of those buildings for the rental evictions. The cost of housing, interest rates on the rise. See, new builds, they can charge whatever they want for rent. Older properties, they have to go by the guidelines of, I think it is about 2.5% a year increase on rent. So this is where these rent evictions come into play. Because they know they only can get 2.5% each year on the rent in order to get more. So someone's paying $800 a month for a 1-bedroom, or maybe around $1,100 for a 3-bedroom townhouse. And these landlords come along and say, oh, we're going to do some renovations. You got to move out while we do this. And you don't have to move out because, the landlord has to apply to the landlord's tenants board in order to do renovations. If he's doing a rental eviction. Or they may come along and say, oh, I'm going to have a relative move in. And the relative isn't actually moving in. It's just to get you out so they can double the rent. When you have an income, whether you're on disability or you're on a low wage income, because rent should not be more than 30% of your income. And when it starts creeping up to 40% and 50%, it's unlikely that you're going to be able to afford the next place to live. Never mind trying to put food on the table. And these landlords have no qualms of doing this. Anyone can become homeless. It could just be an illness come along that you can no longer work, an injury that comes along that disables you. Company goes out of business, closes down, layoffs. The affordability becomes harder. Far too many people are struggling to pay their rent and put food on their table. And people just think, okay, people who are homeless, well, they have mental health issues. That's not true. That's not all of it. True, yes, they do. Some do, but not all of them. So their health and wellness is going to deteriorate much faster than yours and mine. Chronic diseases and disorders, like hypertension I mentioned and diabetes are common in the homeless population. They're going unchecked. Cardiovascular disease, so the homeless adults are 2 to 4 times more likely to have hypertension than other cardiovascular diseases than the general population. Diabetes among homeless adults is around 4.1%. And only slightly higher than the prevalence of 3.2% in the general population. Just the survival. I mean, as winter was approaching and the city scrambling to find solutions to the more than 600 homeless people here in the city of London, Ontario. Trying to make efforts of accommodations and putting more supports in place. They estimated that there'd be anywhere from 300 to 400 people still left out in the cold this winter, sleeping in makeshift tents, tent encampments. Oh, they'll have supports coming around. There's I think there's something like that I've heard. I think there's something like 3 tent encampments up in various sections of the city. They have around the clock um, checkups. They're getting they're getting food. They're getting water. Uh, they have their washroom facilities. So they're standalone toilets that get dropped off at these sites. But anywhere still from 300 to 400 people. Go the entire winter without shelter. How that's going to be with their mental health and their nutrition. It's not good at all. I don't know. Back in 2016, I volunteered in a homeless shelter, not very far from where I reside. Good people, good people that work there. And so people, would think that, oh, they want to be homeless. It's not like they woke up one day and looked at the place they lived in and threw a bag over the shoulders and walked out the door. The whole misconceptions about homeless people. You don't have to have a mental illness to be homeless. It's the homeless people, physically what you see on the streets. But you don't see the hidden homeless. You don't see people generally sleeping in their cars. Unless you really know where to go look. Walk around your neighborhood. Go to your local coffee shop. Downtown. If they make their way out to the shopping malls, they'll make their way out to the shopping malls. They're looking for places to stay warm. They're not out there bothering anybody generally. The lack of affordable housing, the lack of housing for decades. We haven't here in the city that I reside in, we haven't built social housing in 20 years. And they wonder why there's a 10-year wait time for people to get into social housing. And even longer if you have a mobile disability, that could be up to 12 years. Back after the wartime, we had housing shortage. Government went to work and built houses. The lack of the government input, whether it's federal, provincial, municipal, all plays a factor. Wages. Yeah, wages have come a long ways when it comes to minimum wage. But every province and territory has a different minimum wage. It's not the same thing all across the board. Here in Ontario, I think it's $16.65 an hour is minimum wage. Still not enough to live on. That's just the minimum wage that the employer has to pay you to start a job. $17 an hour enough to live on? $18? I think last year they said $19 was the livable wage here in London, Ontario. I scoffed at that and I thought that's just absolutely ridiculous. Now that the rents are much higher, an average one bedroom goes anywhere from $1,600 to $1,800 a month, and $19 an hour wage. That's not going to cut it. So where do we level off on affordability? Where do we level off on a livable wage? Should we drop minimum wage and have a standard wage across the board starting at $25 an hour? With wage increases to go along with inflation. I don't know what the answer is. I really don't. I don't know what the answer is to um, homelessness. And neither does the government. It's a crisis, and it's really too bad that they allowed it to get out of control the way it has. Right across the country, here in Canada, every single province and territory is experiencing a homeless crisis. Even the opioid crisis. Vancouver, British Columbia, in the lower East End is the epic center of the opioid crisis. And of course, chronic homelessness. They're working on this, and unfortunately, when you don't have the resources to solve homelessness and housing being ignored for as long as it has been, Will we solve this problem? I don't know. I really don't know. With the rents on the increase, people facing rental evictions or any sort of eviction because they're struggling, would just lead to more homelessness. And it's not just, when it comes to nutrition and, there's obviously they're not going to have that proper diet. They're going to get food where they can get food. The organizations are going to go out there and give them some water, give them some food. But that's going to be potentially even just once a day. And that's it. So I go in the mornings, I go get a coffee. And there's always, every day, it doesn't matter, somebody, even a couple of individuals, are hanging around the coffee shops just asking for spare change so they can get a coffee or something to eat. I don't give them money. I'll go in and I'll get them a coffee. If they want a breakfast sandwich, I'll get them a breakfast sandwich. You don't have to just to go to one area, where people think, oh, homeless people are just in one geographic area of the city. That's not the case. They'll think they'll just be down where the shelters are, and the services. They're spread out across the city. People look at that and just think people who are homeless, they have mental issues and they're dangerous, and all this misconception about people who are homeless. I mean, it's ridiculous. And like I said earlier, anybody can become homeless. Could be an illness, an injury, and that you can no longer work and that you have to go on a disability. Or just maybe that landlord wants you out to double the rent. Working on solutions is time consuming. Acting upon the homeless crisis Is it ever too late? I don't think it's ever too late, but it certainly sets things back even longer periods of time. Well, they start to set up their resources and come up with ideas on how to solve homelessness. Well, I guess we just have to wait and see what the city that I live in are doing. And we can take a look at that um, on the next show um, next Sunday at 8 a.m. And I'm glad to be back here. And I'm glad to have you on my show because this is actually only the second show of the new year, and a lack of shows in from 2023, you know, um, just dealing with, uh, things that are going on in my life. Um, Losing um, our father passing away last April 2023, um, really struggled. I really, really struggled with it and still am. But as time goes on, I don't know. I'm just moving forward the best that I can. And I set this show up back in 2019, so matter of fact, January 2019. And now it's January 2024. And coming back out doing this show, because I used to do it Saturdays and Sundays before anything happened and that, but coming back out, restarting up the show again, doing it once a week, Sunday mornings. I find it much easier that way. I find it, easier to do some research on a topic. So, and that's how, I'm going to do it once a week, Sunday mornings at 8 a.m. Eastern Standard Time. Now, I changed up my equipment a little bit. Um, Picked up this new microphone, the Shure microphone. And there was really nothing wrong with my other microphone. This was a want, not a need. But I've heard so much about them, and I hope the sound is coming through really well. I did do a little test before I started the show, and thought it sounded great. Let me know. You can always leave a comment afterwards, and that. So yeah, I got to get on with my I got to get on with my day, and I'm sure you have to get on with yours. Uh, it's Sunday, and yeah, some running around to do, of course, and then back to another week coming up. And of course, the temperatures are going to be much better than what they were in the past week. From temperatures from 20 below to 30 below. And it's funny how it's going to take a swing to be above zero for a few days next week. That's the Canadian winter for you. And that was just here in southern Ontario. Western provinces were experiencing a cold of 50 below, minus 50 below zero. Some parts of the western provinces, so that's cold. But just think, I don't know, I think another week, 2 more weeks, it looks like. We'll be in the middle of winter. So, we got approximately 8 weeks of winter to go. 8 more weeks. We'll get through it. So until next Sunday, ladies and gentlemen, take care, be safe. If you can join me next Saturday at 8 a.m., that's great. If you can't, I understand. Thank you for joining me today. And enjoy the rest of your weekend.